Good afternoon, everyone, and thank you for joining us today. Before commencing the webinar, I'd like to invite CNA President Claire Betker to share a message on behalf of the Canadian Nurses Association and the Community Health Nurses of Canada. Over to you, Claire.
Thank you, Aidan. Welcome everybody to this webinar today. My name is Claire Betker, and as I said in the chat box, I'm from Winnipeg, Manitoba, and it's sunny here in Winnipeg today. But I want to start today's webinar with two important messages from the Canadian Nurses Association, and I'm currently the president of the Canadian Nurses Association, thanks to being nominated by the Community Health Nurses of Canada. And my term as president will be coming to an end at the end of June, so just really in a few short weeks. So I want to start by thanking all of you for what you're doing every day, for the leadership that you're bringing, for the knowledge, for the evidence, for the skill, for the care, for the compassion that you're bringing every day wherever you're working, from coast to coast to coast as community health nurses. We at the Canadian Nurses Association are proud to represent all categories of nurses, so licensed practical nurses, registered psychiatric nurses, nurse practitioners, and registered nurses. And there are more than 430,000 regulated nurses in our country. So thank you from the bottom of my heart for what you're doing every day, day in and day out, and what you will continue to do as we move through this unprecedented, really, event of COVID-19 and the pandemic. But also thank you from our board of directors, from our officers. Tim Guest from Nova Scotia is the incoming president-elect right now, and also from our staff at CNA, our very, very talented and dedicated staff, two of which are here helping us today. And I just want to say, it's the year of the nurse. 2020 is the International Year of the Nurse and Midwife, and I can honestly say never in the 42 plus years that I've been a registered nurse in Manitoba have I ever been more proud to say I am a nurse. So thank you from myself and our board and all of our members. But I also wanted to bring an important message from CNA and to recognize that we are very, very deeply saddened by the senseless act of violence that took place in Nova Scotia over the weekend. And to learn that two of the people who were murdered were members of the nursing family and were actually employees of VON, the Victorian Order of Nurses, Nova Scotia. Heather O'Brien was a licensed practical nurse, and Kristen Beaton was a continuing care assistant, and very, very important members of our community health nurses community. So our thoughts, and I know your thoughts join with us, our thoughts are with their families, their friends, with their employer, VON Canada and VON Nova Scotia, and with their communities, for which they were very, very important members. Nurses and all healthcare providers are leaders, and we are bravely always providing care to the public during challenging times like COVID-19. And it just seems like a particularly brutal added blow that this would occur during this period of time. So I just want to say that we're sending our love, our courage, and our strength from CNA, from myself, from our staff, our board, to all of you and to all of the nurses in Nova Scotia, and really mourning the loss of Kristen and of Heather, and for everyone who's been impacted. So thank you for the opportunity to speak today.
Thank you so much, Claire, and I know we all join you in sharing those messages. We will now commence the webinar, and as always, I would like to welcome everyone to the Canadian Nurses Association webinar series, Progress and Practice. This webinar is the Community Health Nursing Facing the Reality of COVID-19 Pandemic. This session is being recorded for nurses who are unable to participate today. My name is Aidan Hampson. I'm a policy advisor at the Canadian Nurses Association, and I'll be hosting the webinar today. At the end of the presentation, we will answer your questions, which you can type in the Q&A box that you see to the right of the slide, and we will address as many questions as time allows. The certificate of participation will be emailed to you along with the link of the recording of this webinar. And now a little bit about our presenters: Michelle Johnson, Shauna Lalonde, and Ruth Schofield. Graduating from the University of Manitoba with a Bachelor of Nursing, Michelle Johnson has worked in community health for over 30 years, primarily in public health nursing. With an interest in communicable disease, Michelle obtained a master's degree in science, infectious disease, from the London School of Hygiene and Tropical Medicine. Her research focused on beliefs of Heterite mothers toward immunization. Michelle has coordinated new vaccine campaigns and communicable disease, provided immunization education for professionals, participated in writing the National RN exam, taught and mentored nursing students through Brandon University, and worked with Manitoba Health to develop provincial public health nursing standards. Michelle recently retired as a rural public health nurse in Bosvay, Manitoba, but continues to work casual. Shauna Lalonde has her master's in nursing from the University of Victoria in British Columbia. She has worked as a community and public health nurse in both rural outpost and inner city settings, and currently focuses on supporting the health of vulnerable populations. Most recently, Shauna taught as a sessional instructor at McMaster University and held a faculty position teaching in the Bachelor's of Science Nursing program at Camison College in Victoria, BC. Lastly, Ruth Schofield is an experienced professor in community health nursing, having taught at McMaster University and Western University. Her research activities focus on community health nursing, nursing education, and mental health and housing, with several peer-reviewed publications and textbook chapters. Ruth has over 23 years of public health nursing practice experience in frontline and management positions and in various programs. She has been a chair or general member on several provincial and national boards. Most recently, she became an accreditor for schools of nursing in Canada. She has led several national research projects in the development of the community health nursing standards, competencies, and educational guidelines. And I will now leave it over to our fantastic presenters.
I want to say thank you to the Canadian Nursing Association for the opportunity to present this webinar for community health nurses. The following are the objectives for our session today. First, we'll discuss the context of COVID-19 and community health nursing practice. Then we'll consider the current knowledge of COVID-19 resources. Together, we will share the challenges and successes experienced by community health nurses in protecting the health of communities. Nursing roles and opportunities faced during this pandemic will also be explored, as well as the ethical considerations in providing infectious disease control and prevention approaches. Next slide. So as for the setting for COVID-19, the World Health Organization on March the 11th declared COVID-19 to be a pandemic. This was due to the alarming levels of spread from Wuhan throughout regions of China. And the shift from travel-related transmission to increased community transmission led to federal, provincial, and territorial decisions to escalate the pandemic response. This included closing the border to non-Canadians on March 16th and invoking the Quarantine Act on April the 9th. Next slide. For over a century, community health and public health nurses have been providing frontline care to communities during pandemics, COVID, SARS, H1N1, and historically during the Spanish flu. And during the Spanish flu pandemic, the strong role of nurses and their skills and leadership became visible and began to be recognized for their work, especially in health, community, and public health. Next slide. We know that Florence Nightingale is the founder of modern nursing. She was a researcher and a statistician and a powerful nurse leader who pursued an evidence base for nursing practice, and her principles of hygiene and cleanliness are foundation to modern day nursing. These principles remain relevant to community and public health nursing practice in the fight against today's coronavirus pandemic. Next slide. Thank you. Currently and historically, community health nurses care for the community as their client, and they work in a variety of settings. There are population groups within the provinces who have environmental difficulties in complying with social distancing and hygiene strategies because they're living in crowded environments. We also find that community health nurses are working with clients and families, and they have complex caseloads with vulnerable populations, and working with clients with varied levels of acuity and comorbidities. And these clients are clients who are at increased risk of mortality if they contract COVID-19. Also, we have nurses working in various geographical areas. And some of these areas increases the increase the population's vulnerability, as living in rural areas often means reduced access to healthcare. For example, testing and medical management of acute illness. So to engage in evidence-informed practice and decision-making, community health nurses need current informed resources regarding COVID-19. As following this pandemic is an infodemic, which is a complete overload of conflicting misinformation. Could you bring up the poll question, please, and the next slide? So it's imperative that nurses know where to obtain current reliable information. And when the guidelines were written for public and for healthcare professionals around the prevention and transmission of COVID-19, a number of assumptions were taken in the development of these guidelines. And these assumptions are based on currently available scientific evidence and expert opinion, and they're subject to change as new information on transmissibility and epidemiology becomes available. Next slide, please. So we're going to talk about what we know currently about the communicability of COVID-19 and also transmission and protection factors. So we know the incubation period is believed to be between 2 and 14 days, and the communicability period is between 40 hours prior to the onset of symptoms to 10 days after the onset of symptoms. People who are infected with COVID-19 may be infectious before showing symptoms. Therefore, during contact tracing, contacts include people who have interacted with the COVID-19 positive person 48 hours prior to that person developing symptoms. We also now know that viral shedding, therefore communicability, may occur for longer periods in immunocompromised and pediatric populations. Next slide. We're all very familiar with this infographic with regarding transmission. And we realize that it's by droplet, and also if someone is coming in contact with an infected surfaces. However, some new information has been emerging. We know that asymptomatic and pre-symptomatic of COVID-19 is occurring. However, it remains unclear if it's a major driver of transmission. It's also been noted that fecal and oral fluid transmission of COVID-19 virus could be occurring, but this is not considered to be a major driver of transmission. Zoonotic transmission associated with COVID-19 is possible. However, there's no evidence that pets can spread COVID-19. If anyone has any questions about pets and people who have COVID-19, it's important maybe to look at the BC CDC website and new information that's come out on the federal government website. Next slide, please. Could you go back, please? Thank you. So we're all familiar with the COVID-19 prevention strategies that are required in order to break the epidemiological triad. And next slide, please. So currently, community health nurses and public health nurses have strong roles to play in health promotion and transmission prevention, health protection and maintenance. So nurses are at the forefront of providing education to people, whether it be to the general public or education to families, and this could be pre and post screening and post recovery. They're heavily involved in the screening of clients. This could be done via phone or at testing sites. And nurses are very involved in setting up and running and organising testing sites. They also are working to follow up in the community sector for clients who are vulnerable, either due to their comorbidities or to clients who are isolated and quarantined. And nurses have a very strong role in contact tracing. Next slide, please. As far as resources are, the Canadian Nursing Association have collated resources to support nurses in respect to the coronavirus. It's a very easily navigable website, and the Canadian Nursing Association have collated information with regards to PPE and ethical issues, etc. We also know that the Public Health Agency of Canada and the World Health Organization are reliable sources. Next slide, please. And nurses are encouraged to go to their provincial websites or their territorial websites, as well as the Government of Canada. What I've noticed is that the websites often state where their sources came from. So they may have taken information from World Health Organization. And we're tending to find now that provincial websites align more directly with what is being seen on the government websites. It's also important to have a look at the date, which is usually at the bottom of where the website was last updated, to make sure we've got the current information. Next slide, please.
Thank you, Shauna, for setting this context and on COVID-19 pandemic. And this is Ruth. And thank you for the response to the poll. So clearly, Public Health Agency in Canada and provincial territory sources are certainly informing many of your sources. So that's great. Shona, maybe you can turn off your mic because I think there's some interference happening. So we're now going to move on to what we've heard from community health nurses in Canada about their reality. To understand this, we conducted a quick and brief survey, and we asked 4 questions. What was your experiences that you're facing? What are challenges? What are successes? And what are some ethical dilemmas that you're facing? And here's what they told us. And we heard from nurses in Saskatchewan, BC, Ontario, and Nova Scotia, from both home health and public health nurses. But first, before we do that, we're just going to ask another poll. So if we could have the poll and also have the next slide. Thank you, Elizabeth. So let's hear this is what community health nurses said in response to the first question. What experiences are you facing? And the first reality that many of them described was an overwhelming, constant, and rapid change from usual practice. The redeployment, especially in public health, to contact tracing and case management, testing centers, and early discharge programs. They talked about working longer hours, different and more shifts, and weekends and at home. Reprioritization of services they identified. Home health support for clients were shifted to clients discharged from hospital. Reduced services such as child health clinics were only offering immunization, and all other assessments moved to a virtual screening and support such as breastfeeding. Reducing school immunization programs, health promotion activities, and working with the community. Less STD follow-up, and likewise, clients were not able to attend public health nursing services due to self-isolation. They also identified in this overwhelming change the adaptation of services, developing new safety planning where there was disclosure of intimate partner violence. Physicians were redirecting postpartum care to public health nurses, rapid assimilation of new and changing information, the use of multiple documentation systems, maintaining a clean workspace, and the use of PPE and multiple conference calls. I see that virtual communication clearly came up as a common major change of reality, which is clearly coming through, isn't it? And another reality was the change in client interaction, which touches on this virtual communication. New assessment tools, such as COVID home site checklists before any home visit, responding to the impact of COVID on vulnerable client populations, such as those individuals experiencing anxiety, depression, food security, requiring more than one nurse to visit if home environment wasn't safe, replacing face-to-face with virtual clearly came through, different communication strategies and support with First Nation leaders and communities, constant monitoring of clients in the home with chronic conditions, as Shauna identified earlier, and taking precautions. And the last theme heard about the experiences community health nurses were facing was the change in community supports, reduced and closed refugee centers, bath programs were being canceled, respite services were canceled, needing to engage with new partners. Next slide. So we then asked them, what were some of your challenges? And they identified a number, not surprisingly. The first challenge was the umbrella of uncertainty, being able to provide support in a context that was unknown and constantly changing, and how to make decisions in that context for program delivery and client care. The second challenge that we heard was about community health nurses' well-being, feeling burnt out, worried about their health, families and others, childcare issues, nurses being sick, waiting for tests, work-life balance and physical separation between workspace and personal space, PPE restrictions, need to sign out, hand sanitizer, gloves, masks, and gowns, vigilance in maintaining precautionary measures in all interactions and touching in the workplace and the home environment, accessing uncontrolled and potentially unsafe home environments. And the third challenge was that community health nursing leaders was the whole aspect of communicating in a timely manner to all staff, be it full-time or part-time, and then interpreting the shifting policies to staff. And that some staff with the shift to virtual communication really didn't have the same level of computer savvy. And the fourth challenge was the impact of redeployment, the need for training, which was sometimes rushed and inadequate, the lack of physical space and reorganizing physical space to respect precautionary measures. And the fifth was communication with clients, as noted earlier about the experience. Some clients were unable to be reached because they had no Wi-Fi, no internet, phones, or radios. Clients with dementia who may not respond to calls or know how to use the phone. Clients seeking information or assessment had to wait 2 or 3 hours or 2 or 3 days for follow-up. Constant changing information about precautionary measures, responding to violations of advice from health departments to self-isolate, expressing frustration with delay in receiving test results. And the sixth was a strain on therapeutic relationships. So the whole aspect of social distancing, the lack of privacy in virtual visits while in public places or in contact tracing, responding to caregiver support and the challenge of supporting caregivers who had loved ones in long-term care, The seventh was the risks to the priority population. Pregnant and breastfeeding women were anxious about the COVID. Clients' capacity to navigate the system for financial supports, navigating community, seasonal, ceremonial rhythms within the Indigenous population, food security, the idea of hoarding infant formula and concern for watering down the formula, concerns raised by long-term care homes about the lack of PPE, the use of precautionary measures with wondering residents. And the last key challenge identified was the hospital community communication. There was different security levels between acute and community care in access to chart information. And public health would have had client child health clinics located in hospitals, and they were closed. Next slide. So the last question we asked, or the third one we asked, was, though there was tremendous challenge, what successes were they experienced? And yes, they were certainly willing in this context, able to identify some successes. First and foremost was the amazing resilient qualities of community health nurses. This was shown, excuse my emotion, it's a bit overwhelming. Shown was their flexibility, adaptability, and innovation in redesigning and using technology to promote the health of Canadians. For example, from multiple nurse to single nurse clinics, the use of text-in request to PHNs for contraception, which PHNs would deliver to a client waiting outside, visiting in clinics versus home or outside, weather permitting, weighing babies in nurses' vehicles while parents watched from their window, increasing contact between client and nurse through phone screening, viewing a client's home through video conferencing to determine the level of safety, triaging care needs by phone. The second theme, overwhelming, was the support they felt from their organizations. For example, their management team were available and supportive of them if they have to remain at home. There was support for the use of computer charting, iHealth, and access to IT support given this virtual shift. They received necessary training from IPAC or emergency preparedness, they had regular updates. The third success was that priority populations were actually gaining access to services, especially as some of the essential services. Clients seeking help, for instance, those were actually disclosing intimate violence. And one key comment here was being able to visit to keep a client safe is a success. The fourth success was the opportunity to strengthen and form new partnerships. And first, for instance, with First Nations and with Allied Health. And the last poignant comment made from a community health nurse was about the success that the provincial healthcare system was now recognizing the erosion of public health nursing. We are keen to hear your experiences and challenges and actions needed in the Q&A that will follow Michelle's section. So you'll be able to give your comments in chat, but your questions in Q&A, which we'll get to after Michelle. We're fortunate to have Claire with us and Cheryl, as you heard, and they will be able to respond to some of the Q&As and the comments in terms of actions that both CNA and CHNC can respond to. So now I'm going to have Michelle talk about the ethical issues that we've heard and ideas for resolve. So if you can move to the next slide. Thank you.
Thanks, Ruth. Michelle here, and I'm coming to you from the farm, so I'm hoping there's no external noise. I kicked the dog out into the garage. I kicked the husband outside into the farmyard, but I can't control the cattle in the backyard. So hopefully that will be all quiet. Anyway, all of those challenges that you found that were raised by community health nurses will help us focus on a look of ethics in our work with COVID. Ethical situations or challenges can be found in everyday community health nursing. However, the current COVID-19 pandemic brings so many more of these ethical challenges to light. How do we, as community health nurses, face these challenges? And how can we reconcile our practice within an ethical framework that we can utilize individually or as a group? In a CBC radio interview, April the 7th, retired Lieutenant General Romeo Dallaire compared this COVID-19 pandemic to a war. Dallaire led the United Nations peacekeeping mission in Rwanda during that country's genocide. He has become a spokesperson on post-traumatic stress disorder after being affected personally himself. He states that the impact of the current pandemic on healthcare workers should not be underestimated, that they are making potentially life and death decisions. Dallaire emphasizes that healthcare workers are going to see the eyes of these people when they tell them things, and they are going to see the eyes of their own staff, knowing that there's going to be an impact on some of these patients. His message to healthcare staff is to trust their instincts and rely on each other in the work ahead. Next slide, please. While nurses often use well-honed instincts while providing excellent care, what are some of the systematic methods or frameworks that they can use to help them with some of the ethical challenges that will arise while providing care during this pandemic? In a recent CNA publication, an ethical dilemma is defined as having equally compelling reasons for and against two or more possible courses of action, and where choosing one course of action means that something else is relinquished or let go. Therefore, it can be seen that an ethical challenge has no easy answers, but often very difficult options, like finding a fork in the road. Next slide, please. What are some examples of possible ethical issues for nurses that may arise? We are already hearing stories from community health nurses about concerns that they have. How do they protect themselves from the virus in a home or clinic setting while also providing competent care and protection for the client? Community health nurses are aware that PPEs need to be chosen appropriately and used efficiently, if not sparingly. And will they continue to practice if supplies run out? They have questions about what community health's essential services are and what the priorities will be. They are concerned about vulnerable clients and how decisions will be made about who receives services. This may also include providing services to Indigenous communities and how they consider health equity in this population. What about the nurse's duty to care when the nurse or their family members may be immunocompromised or have a chronic disease or are just afraid? The BC Centre for Disease Control explains duty to care as the healthcare workers being bound by an ethic of care to the patient's well-being. However, they also say where it isn't possible to mitigate risks of harm to the healthcare worker, that the nurse can discharge their duty to provide that particular activity of care. At what point would the nurse consider this? Next slide, please. An ethical framework can help community health and other nurses to address ethical issues with information like provided in the CNA Code of Ethics. This document provides guidance for nurses working through ethical challenges that arise in practice with persons receiving care and with colleagues in nursing and other fields of healthcare provision. The code lists two components: nursing values and ethical responsibility, and also ethical endeavors related to broad societal issues. The 7 nursing values include A, providing safe, compassionate, and ethical care. And I see on our slide we have compassionate, so I know we nurses are compassionate. B, promoting health and well-being. C, promoting and respecting informed decision-making. D, honoring dignity. E, maintaining privacy and confidentiality. F, promoting justice. And G, being accountable. Next slide, please. The Code of Ethics describes the Oberle and Raffin model, which asks questions of the nurse for ethical reflection and assessment. The model lists 5 questions, each of which have a number of points to consider. But the 5 main questions include, number 1, assessing the ethical situation, the relationships, goals, beliefs, and values. Number 2, reflecting on possible actions or choices. Number 3, selecting an action and details about this action. Number 4, carrying out the ethical action. And number 5, reflecting on the action taken. It's also helpful to consider the standards of practice from the Community Health Nurses of Canada when using the framework. These standards include, number 1, health promotion. Number 2, prevention and health protection. Number 3, health maintenance, restoration, and palliation. Number 4, professional relationships. Number 5, capacity building. Number 6, health equity. Number 7, health-informed practice, rather evidence-informed practice. And number 8, professional responsibility and accountability. So all of these standards will sound familiar in terms of the work that you do in community health. Next slide, please. Let's take a look now at how the Oberle and Raffin model can work in practice. Remember, this is only going to be an example. Everyone will encounter different situations that they find to be ethically challenging. Here's our scenario. Davis Caron is an experienced community health nurse in his rural practice area and is leading a team for COVID-19 testing. Testing for the coronavirus is to be completed in both the town and the nearby First Nations community in the area where Davis works. However, testing supplies are found not to be sufficient for both areas, and more test kits cannot be supplied until 1 week later. Davis is struggling with how to proceed as both communities have need of testing and there are community members with symptoms. The leaders of both are eager to hold a testing clinic. Davis decides to use the Oberle and Raffin model to assist him in working through this ethical challenge. We will follow step by step through this with Davis. Number 1, the community health nurse begins by assessing the ethics of the situation, the relationships, goals, beliefs, and values. Davis lists important relationships to be those with community leaders, community members, and public health leaders. He also considers relationships with his own family members in the town. He knows the goal is to assess the numbers of people infected with the virus, which can show the extent of the community transmission and indicate those needing quarantine to slow transmission. He knows another goal is to provide more protection to those who are most vulnerable to severe disease. He identifies the Code of Ethics values of providing competent care, promoting health and well-being, promoting justice, and being accountable as values that particularly speak to this issue. Number 2, next, the community health nurse reflects and reviews potential options. Davis knows each community expects testing as a priority, but knows the First Nation community has a more vulnerable population. And in terms of health equity, this population could gain more benefit from testing and resulting actions. But he also knows there will be moral distress from not providing testing for the town residents. Number 3, the community health nurse selects an ethical option. Davis does this by asking himself which action he believes is best, how he can support the needs of the community, and if he has the knowledge needed. His decision is to test the First Nation community members with symptoms as a priority, but also symptomatic members of the town who are at greatest need, for example, those with underlying conditions. Number 4, the community health nurse now engages in the action. While working to complete the task, Davis reflects if he is practicing as a prudent nurse would do, if he is acting with care and compassion, and if professional and system expectations are being met. Number 5, after completion, the community health nurse reflects on this ethical action or choice. Were the outcomes acceptable? Did all feel respected and valued? Was harm minimized and benefit maximized? What was done well and what could have been done differently? Let's answer the next poll question. Next slide, please. Before we have time for discussion, we would like to leave you with a key message. And this is one that comes from Her Majesty the Queen during her April 5th address, and that we feel is fitting as we speak to you, our community health nurses, delivering the very best care you can to those in need. Across Canada, countless people continue to care for the most vulnerable and to provide essential services for their fellow citizens. I am thankful for their dedication and for the hope that it offers. Her Majesty the Queen. Next slide.
Excellent. That's good.
Thank you, Michelle, Shauna, and Ruth for such an insightful and engaging presentation. And clearly that example was incredibly useful for many of the members. We do now have 2 CNA polling questions before moving on to the Q&A, which you should see come up on your screen now.
And while you're answering that, do you want us to move on to the Q&A?
Yep, we will now start the discussion portion of the webinar. If you haven't already, please type your questions into the Q&A text box. And we do have a few questions that we want to use to help start the conversation, which you can continue in the chat box. Some of the questions we would like to ask you, the attendees, are what are the experiences that you're facing with the COVID-19 pandemic? And what are solutions and how can we actually address some of these solutions moving forward? And I'll hand it over to you, Ruth.
Thanks, Aidan, and all of us actually will participate. So you will note that we'll pull in different folk. But and thank you for mentioning those opening questions. But in fact, we had some that came through, which was great to see. So please continue to put your questions in there, and recognizing our time is limited. And so we feel free to please still put in your questions or comments, because we will track all this, so we may not be able to respond to all of them. And so I think there's a couple that perhaps we can quickly respond to. I think the first one that I see is about CHNC and CNA, considering this an opportunity for public talks to promote community health nursing. What better time to do this? And so I think that's a challenge to both CHNC and CNA, and just wondered whether Claire and Cheryl could respond to that quickly, so we can maybe get to 1 or 2 other questions given our time.
Hi, it's Cheryl. Thank you so much for this fabulous webinar and for the very important question. I think as we can see, as we're moving forward with COVID-19, it is going to be increasingly important for all of us, CHNC and CNA and other stakeholders, to continue to work together and to support community health nurses in their practice. From the Community Health Nurses of Canada, we are the Centre for Excellence for Community Health Nursing, and we're aiming to provide a unified national voice and leadership to advance policy and practice excellence in community health nursing. We appreciate that that goal isn't something that we can achieve by ourselves, and look forward to working with, in particular, CNA and other key stakeholders as we continue to address this COVID-19 pandemic.
Did you have any comments, Claire, that you wanted to have in terms of how we can advance community health nursing?
Well, yes, actually, I've got lots to say, but I'll just keep it really, really quick. I've done a lot of media, which was not my intention to be doing during this period of time, but that seems to be the role that's being asked of me, and I'm happy to develop those skills and to step up to that. But what I've tried to do in all of that media is to paint the broad picture of nurses and nursing, and that around the multiple settings that we work in, so including the streets, public health nursing, nursing stations, community health centers, home care, long-term care, that broad continuum of care. So I think it is, I would agree with the person who's asking the question there, that this is a really important time to shed light on those broad continuum and dimensions of nursing, and in particular community health nursing. As I said in the beginning, I have worked for more than 40 years in the community. So it's an interesting time to be the president of CNA and to bring that perspective to it. And most of that time I've worked actually in public health, although did 10 years in continuing care or in home care. What I wonder, this is an excellent webinar, excellently done, very, very well done. We are doing Coffee with Claire on Fridays. There is one tomorrow where I'm talking with someone from the Public Health Agency of Canada. So Cheryl and others within the executive of CHNC, along with my colleagues inside CNA, is there parts or some of this that we could bring to Coffee with Claire on Friday? Because we're going to continue those conversations. We've had a really good response to them. And I think even within our own nursing colleagues, there has been and continues to be a lack of understanding of our roles and our incredibly valuable contribution, not just now, but in the past, and the contribution that we're going to be called upon to make on the way forward. So I love your question, and let's contemplate what we can do here.
I think, Claire, it's a good point you raised that there are actually two opportunities that I see have jumped out in questions that have been raised. One is the concern for the post-pandemic planning and infrastructure needed for the potential for a second wave. Is there opportunity to advance the resources available for community health nursing to cope with that? The second one raised by Susan Duncan,
Yes.
good for you, Susan, is the need for research in community health nursing. We're hearing about research related to health research, but we need to have something in community health nursing. So is there opportunity at this meeting? And also just doing that public talk that somebody raised as well, bringing the profile of community health nursing, because we're hearing it in the media all about acute care, very little about community care. So are those a few things to consider?
Certainly, Ruth, absolutely. And thank you, Susan. Duncan, I'm waving to you virtually. I would agree, and we are at CNA, the Canadian Nurses Association, right now just finishing a statement or a position in terms of long-term care. But within that long-term care position, we were going to consider also home care, long-term care in the community as well. So absolutely. I'm going to put a different hat on for a minute. As the scientific director for the National Collaborating Center for Determinants of Health, I'm also going to say that many of our own community health or public health colleagues don't always understand our role and our value as nurses in this system. I even wondered about writing, if you would think about writing a blog or some kind of a piece that we could put on our website. So Ruth, I'll follow up with you or Cheryl or whomever around that as a way, even within the public health community, to draw attention to the value and the role of community health nurses in all of those multiple settings that we work in, and our voice on behalf of those people who are so vulnerable, and their vulnerability being increased and amplified as a result of this pandemic.
Yeah, it's Cheryl speaking. I completely agree. I think that right now, while we're seeing the health system transform in a way it never has historically, and I think it is going to, moving forward, we're going to continue to see many opportunities created for nurses across settings, but especially in community roles. It requires strong nursing leadership, policy advocacy, and research. Research is so important that makes visible that those roles that have been largely invisible and played by community health nurses. Because we know that we can improve the health and reduce inequities among individuals and populations in Canada. And you know, so I think now is an important time to provide that leadership and to acknowledge that important work and that full scope of work that nurses are doing. And I love the idea of a blog. In the discussion previously, there was lots of actually examples that I myself hadn't thought of, and really highlighted, I think, how nurses are being innovative, how they're using evidence-based information, and they're adapting to improve and promote the health of the clients and communities that they're working with at multiple junctures. So I think lots of ways to move forward.
And there's just one more thing that jumped out I saw from a response is there's still issues in some provinces like Alberta where there's not enough PPE for community health nurses, and that did come through in our little survey that we had as well. So just another thought to bring forward. But I'm just looking at the time. Do we have any more time, or are we at the end, Aiden?
I think we have time for maybe one more question before we wrap up.
Okay. There was a question here around preventative mental health concerns and any advice and successes in terms of resources available. I believe there's some sources available, and maybe one of the other panelists can respond to this.
It's Michelle here. I think there's two parts to mental health, which is an excellent question. Excuse me. One is for clients, and the other one is actually for nurses themselves. So the Coffee with Claire last week had 3 excellent mental health nurses who talked about mental health within themselves, within nurses. And so they listed some, Claire, you maybe remember this better than me. I looked some of them up, but it was like the Federation of Mental Health Nurses, I think. So there are some really good mental health resources out there, and both for clients, but also to consider nurses. The more nurses I talk to, I feel like people are having layers of stress put on them that maybe they're not even realizing. And sometimes when there's enough layers, it really affects people. So very good question. Thanks.
There's just one more question, perhaps, Michelle, while you're on, and it's by the question of whether the ethical framework that you went through nicely could apply to other disciplines besides nurses.
Well, to me, that I think it could apply to other disciplines and probably also personal use as well. It's just a pretty common sense way to look at things, but it breaks it down into pieces that you can look at and go through stage by stage.
Good, thank you.
Mm-hmm. Can I ask one more question? Do we have another minute?
Yeah, one more minute.
Okay. I'm not sure I'm answering it, but there was an anonymous question from somebody talking about the social determinants of health and nursing engagement and community organizing, policy advocacy to address inequities that COVID-19 is revealing and putting certain groups of people at risk. People who don't have homes anymore, lost their jobs, etc. And I think that's really important. We didn't specify social determinants of health, but certainly that's our daily lives in community health. And I think that is very much something worth looking at, is not only our current vulnerable or our usual vulnerable population, but who are those people who have become vulnerable in one way or another.
Yeah, good point. Nice of you that you brought that up and noticed that. And I think the National Collaborating Center for Determinants of Health has done some really nice work on equity and COVID-19. And Claire, your last comment.
Yes, and actually it's interesting, the virtual platforms that have really been helpful to us. So we've had a series of 5 conversations, and they are recorded. And the one yesterday actually was incredibly well done. Looking at ethics, but also looking at food insecurity. That speaker was incredible. And the other one was around disability. And some of their ideas were incredibly helpful, I think, and very applicable to community health nurses. So those are recorded, and they're also on our website, the National Collaborating Center for Determinants of Health. And actually every collaborating center has put all their sort of tools down and are focused on COVID. So all 6 of them, so use them and ask your questions. They are a resource created post-SARS. So this is our role, to be in that space. So please, please use us, please talk to us, connect with us in whatever way you can. And I just gotta say, Ruth, I gotta say to them again, thank you so much for what you're doing every single solitary day on our behalf.
It's Cheryl. I just noticed there's a question asking, is there a national platform for community health nurses to connect? Perhaps I just don't know about it. So I just wanted to, I'm sure that you'll be sharing the Community Health Nurses of Canada website and information, and that would be the place to do that. So I just wanted to make that comment. Thanks.
Thanks, Cheryl, for bringing that up. Yep, that's the partnership we have between CHNC and CNA. So we're thrilled that you're able to join us.
And with that, thank you, everyone. Thank you, Cheryl and Claire, for joining us for this Q&A. Also, thank you to our amazing presenters, Michelle, Shauna, and Ruth, for such a great, insightful conversation and presentation. I think this really generated quite a lot of discussion and engagement, and we're so pleased to have been able to host this session with all of you. In terms of moving forward, you can access recordings of our webinars by visiting CNA's YouTube channel. So this will be posted there as well. So I know there's some people were asking about posting them in their classrooms or for students and whatnot. So please check back there. It should be posted shortly. Any upcoming webinars will soon to be announced in the fall. And we'd just like to end by saying, again, thank you for your participation, and please stay safe, everyone.
Thank you.